All right, so right before the surgery, he's got some hairline thinning there, and hopefully he's on medical therapy to prevent further loss. And he's going into surgery, presumably to work on the hairline. Here he is during surgery. They have him all bandaged up, so I don't see what exactly happened so far. Okay, so now we see some grafts placed right at the hairline, including centrally for some reinforcement. This was probably at least 2,000 grafts from what I can tell, with a pretty nice irregularity placed at the hairline and that connection into the lateral hump temporal area. And here he is again at 1 day post. He has some swelling developing a few days after. That is normal, nothing too severe. Day 4, at 1 month post-op, you could see that pinkness to the area. And 6 months post-op, he's seeing definitely more hair growing in. And I think it's important to point out with this short format of his hair, you could see the distinction between the transplanted zone and the surrounding hair. And that is something very real. And I think it's important to point out for people who want to wear their hair short after a hair transplant. Things tend to look more uniform once the hair grows out longer, but when you wear it short like this to maybe a more trained eye, you can see where the transplanted hair stops and the native hair begins. And overall, looks like he's happy from what I can tell with his facial expressions. And this is just 6 months, so it should continue to improve for at least another 6 months after. So if that's the look that he was going for, I think they were able to accomplish his goals well. And I'm all about finesse hairline work. If you look at this example, we actually left the central portion of the hairline untouched per the patient's preference and just worked on augmenting the frontotemporal corners in a very conservative but meaningful way. You don't always need to lower hairlines or even augment the central hairline if the person is content with it. Sometimes just doing some corner work can go a long way. And so each case is very unique and needs to be handled with the right care and attention to get the best possible results.